So we have a young gentleman who has a lot of acne scars, and over times he's had fractional lasers, CO2 fractional lasers, about 6 sessions, micro needling, fillers, and the list goes on and on and on. Then he had a TCA chemical peel that caused a burn in the area that I am going to point out. And that's the main scar right here, that ellipse, small ellipse, that's of main concern to him. So what I proposed was to just first do an elliptical incision along the depressed area. That will lead to a line that's going to parallel the nasolabial groove on the side. So that's going to be less conspicuous than the actual depressed scar. Let's see if we do that. And afterwards, patient said, listen doc, it's still, I only see 2 lines, the actual nasolabial groove line and this line. I don't like it. Then what do? Then we can extend the scar and make a bigger ellipse like you can see and bring the smaller scar into it. Once we do that, then we got one nasolabial groove and everything goes into that. That's the plan. And the patient, I always consult with the patient because patient needs to be on board and they have great ideas as well. Because don't forget, this is for the residents. The patient has been working on this scar way longer than you have. They have thought of every idea, so don't just poo-poo patient's idea. Listen to them and work with them. So this is the first one he agreed. If this doesn't work, we'll go to the big one and we'll keep you posted. Now patient has other scars he's concerned about as well, but I don't want to do too many cuttings. I want to start with only one and see how far we can go, because this is the worst one. And then after that, we'll decide whether I want to excise any of the scars or not. We'll keep you posted. This is part 1. So we've done our markings. This is part 2 of the video, and you can see we did the ellipse for the depressed area on the left side, just like we had shown you earlier. And now going on to the right cheek, where we're making more of a stingray or manta ray kind of incision. When you do the cheek, the outer or upper portion should be convex, and the inferior should be more like a manta ray, where you see it kind of sticks out in the center but narrow on the sides, and that gives a better pull and a better closure, and we'll show you later when we're done. So we have finished our procedure. As you can see, I'll show you from an angle as well. It is raised, and it's raised on purpose on both sides, and that's going to help with eventual healing, so it does not become a wide scar but eventually flattens out and becomes a nice fine line. So this raising is critical, and what I used was deep inside was 5-OPDS for the subdermal sutures or the dermal sutures, and then skin was first vertical mattress sutures and then our simple plain running as well. And I'll take them off in like 4 days and put Derma1, not longer than 4 days, because you can have the railroad marks. And then once the glue goes on, we are good to go.